Everyone, it's Faithful again. Today we're talking about pressure burst pipes. Before we go on to that, I wanted to just let you know that this has been helpful for me, and I was hoping that this is also helpful for you. And if you think it is, I would really appreciate it if you can share with others. My first episode I had said I did not know what I was doing. Honestly, now I do know what I'm doing. My goal and my vision is to inspire someone or to help someone with the knowledge that I have of medicine and in other aspects, my few experiences and the knowledge that I have to help someone. And if you think this has been helpful for you, please share with others, let them know about this podcast, and that way you never know how you can help someone else. So Dr. Osawe smallbites.com is an avenue you can use to actually ask questions, and if I do not know or have the answers, I will talk to other people who do know those answers. You can always use the comment box chat on the YouTube channel, as well as just texting me, calling me, emailing me, and hopefully we can help one another. So back to what we're talking about. What does that mean, pressure burst pipes, in this context? We're talking about high blood pressure. Now let's talk about a little epidemiology. Hypertension is one of the epidemic diseases that contribute globally as a crisis, and nearly 1 out of 2 adults in the US has hypertension, 116 million people, and an estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension. This is a scary number. And 22.4% among adults aged 13 to 39 have high blood pressure, and it increases to 54.5% among those aged 40 to 59 and 74.5% among those aged 60 and over. So imagine 75% of people over 60 years old have hypertension. That is really scary. And one thing to remember is the fact that 46% of adults with hypertension do not even know that they have it. And less than half of adults with hypertension are diagnosed and treated. So what happens to the 58%? They do not even know that they have hypertension. And even if they do know, 21% of those people that do know that they have high blood pressure have it under control. So that means that a lot of people that are walking around, you may say, well, I feel fine, I feel okay, I don't have any medical problem. You keep walking around and have high blood pressure and not even knowing. And hypertension is a major cause of premature death worldwide. It affects an estimated 1.3 billion worldwide. Can you imagine that? And it kills approximately 10 million people every year. So what is hypertension? It occurs when the body's blood vessel narrows and causes the blood to exert excessive pressure against the vessel wall. And this force of the blood, when it's high, that pushes against the artery, when it's so high, forces the heart and the blood vessel to work harder, and over time, referring to the heart muscle, it can thicken and damage the heart and other organs of blood vessels with that. And remember, the heart, even the blood vessels, any blood vessel needs a certain amount of force to push the blood forward. And so when you have high blood pressure, when it's too high, this is a normal vessel, and you can see when it's normal, the blood flows through with a certain amount of pressure. When you're hypertensive, this wall thickness increases, and this increased resistance makes increased force of blood through that vessel. And with time, looking at this, I do not want you to remember the specifics, but blood pressure is equal to cardiac output times peripheral resistance. When you have high pressure that goes through the vessels all the time, this increases the resistance that the blood has to get through that vessel, and the output that you get will decrease with time because of the high pressure. And this activates sympathetic system, and this is sympathetic activation will increase peripheral resistance, and this in turn will make certain neurohormones in the body to increase: aldosterone, angiotensin 2, renin, and all this to just give sufficient stroke volume the body needs to pump out blood. And with time, this becomes a problem. When the heart pumps blood through these arteries, that is called blood pressure. That's the pressure needed to get blood flowing through any vessel. And what is the consequences of hypertension? With time, it increases the risk of heart attack, heart failure, renal diseases, stroke, brain aneurysm. When you have such high pressure in the brain vessel can bust open and cause an aneurysm, which patients can die right away. Cognitive decline and memory loss. That's interesting because now there's this tie of dementia to high blood pressure. Not in all cases, but they are noticing now that dementia can occur in patients, even early dementia, from high blood pressure. Blindness can happen, visual impairment, visual disturbances, sexual dysfunction, complications in pregnancy, preeclampsia or eclampsia, aortic dissection, where you have a tear in the large vessel because of high blood pressure, and patients can actually die instantaneously from aortic dissection. Osteoporosis, which is bone loss. Now, this is a picture here that can tell you or shows you what I was trying to tell you about aneurysm here in the brain, dementia, blurry vision or loss of vision, arrhythmia, which is irregular heartbeat, left ventricular hypertrophy. Like I said, when you have high pressures through the vessels for a long time, it causes the muscles to thicken, and that's called hypertrophy, and this can result in heart failure, kidney damage. When you have hardening of the arteries with time, it can even affect blood flow through the legs, and people can have leg pain, and with time may even have problems walking. And blood clot, osteoporosis, again, is the same thing that is shown under the picture. Now, hypertension and the heart. And before I go on, I made this a different way with PowerPoint so that you can actually go back later and review these things and write things down if you want to, because I know this is a very, very important topic. So feel free to go ahead and write things down, go over the slides again and again so you can jot down things you need to as you learn from the podcast. Now, high blood pressure is again can thicken the heart muscle and consequently can cause chest pain, heart failure with weakening of the heart muscle with time as the chamber cavity decreases. So when you have thickening of the vessel shown under that picture, with time that thickening can cause the chamber of the heart to get smaller and smaller. So then you have decreased blood flow forward whenever you have blood pushed forward out of the heart. Now, also thickening of the blood vessel walls and cholesterol deposit in the blood vessels can cause heart attacks, yes, and strokes, which we see a lot as physicians, cardiologists in the hospital. Now, as I was trying to explain to you, this is a normal heart, okay, and you can see the blood coming out through this outflow tract. But again, when you have high blood pressure with time, this muscles thicken and the blood is harder coming out of here. And again, this is another picture showing you how thickened this muscle becomes, and with time it causes enlargement of the heart, can cause dilatation, it can cause hypertrophy, which is thickening of the muscle, and cause heart failure because of that. Also, again, you can have blood vessel thicken and things deposit, even lipids deposit there, and as this blood vessels now become narrowed, you can have decreased blood flow and can cause a heart attack. Yes, again, like I said, dilatation. You see, this is a normal heart with thickening with time. Even the heart can dilate. And see this is a normal heart, and this is when it thickens and thickens. And as I was trying to explain before, this is the chamber of the heart now narrows, as opposed to here, it narrows so small that now the amount of blood in here is much smaller. So you have decreased blood flow forward, and then blood goes backwards and can cause heart failure. Shortness of breath can occur because of high blood pressure. Now, blood pressure values 120/80. What is that? What is this number? 120 is systolic and 80 is diastolic blood pressure. 120 is the systolic blood pressure, that this is the pressure that the heart needs to push blood out, and this is what happens. The diastolic blood pressure is the blood pressure you need when after pushing blood out, the heart has to rest between these beats. Now, you need just enough of the pressure, not too high, because then it starts to damage the blood vessels and the walls, like we discussed. If it's too low, that's not good either. So I will tell you what the actual normal numbers are, the range we need to have for the top. Okay, the amount of pressure we need to push blood out, and the amount of pressure we need just when the heart relaxes. It should not be too low, it should not be too high. Now, what's the normal blood pressure? 120/80 or lower, that's normal. Okay, when it's pre-hypertension elevated, it's about 120 to 129 over less than 80. We see this will start to get concerned where blood pressure is not super high yet, but it's becoming pre-hypertension. Stage 1 is when you have 130 to 139 over 80 to 89. Stage 2 is when you have 140 or greater or 90 or greater millimeter mercury. When you start getting these numbers, you have to really keep that in check because that's not good. Hypertensive emergency is when you have higher than 180 over 120, and this is really, really bad. When you have this number, you have to seek emergency help right away because these patients can have very great complications. Like patients can die from a stroke can occur, patients can go blind instantaneously, patients can actually have dissection instantly, patients can become very confused and things like that. So I'll talk about that in another slide. Now 130 is too high. So when you start checking your blood pressure, you realize 130 over 80, that should make you think, yes, I have high blood pressure. Now, this is a number, like I said, 120 over 80. And as I explained before, you can take a picture of this and keep this and know this is the number. So like I said, I made a PowerPoint so you can be able to take pictures if you want, go back to it, okay? Now, what are the causes of hypertension? Family history is a very big one, like we talked about in another episode, how high blood pressure can be caused by family history, salty foods, overweight, obesity, stress, a big component. We talked about stress in another episode, actually 2 episodes we talked about it. It's a big component that can cause hypertension. Chronic alcohol consumption, so if you drink a lot, you gotta keep that in check because that can cause high blood pressure. Lack of sleep or disturbed sleep, if you're waking up sleeping, that can actually cause hypertension. Smoking, age above 65 years can, remember, I don't know if I mentioned that to you before, but as we age, our vessel walls thicken and they become less elastic, and so that's why above this age, patients are more prone. About 75% of people in the world have high blood pressure because at this age, because of that. Sedentary lifestyle, when you're inactive, that can cause high blood pressure. Now, other health conditions like sleep apnea is a big cause. So if you snore when you sleep and you notice maybe your partner says, wow, there's episodes where I feel like you don't breathe when you're sleeping, you need to see a doctor to make sure you rule out sleep apnea, because if you have sleep apnea, that can actually cause a big component of high blood pressure. We worry about this a lot as physicians, as cardiologists. Renal disease, diabetes, acromegaly, pheochromocytoma. Some medications can also cause high blood pressure, such as steroids, OCPs, oral contraceptive pills. So if you're a woman, you take OCPs, be very careful because this can cause high blood pressure. Some cough and cold remedies can cause high blood pressure. NSAIDs, some pain reliefs like ibuprofen, naproxen, Aleve, these medications can cause high blood pressure. So if you already do have high blood pressure, be very careful with these medications. Some herbal remedies, some recreational drugs, be very careful. Don't do cocaine, amphetamines, and those can cause high blood pressure. Antidepressants like SSRI, venlafaxine can cause high blood pressure. Some adrenal gland tumors can cause high blood pressure. Congenital birth defects, genetics. So some people may say, well, I eat right, I do everything right, why do I have high blood pressure? You could be predisposed because of your genetics to high blood pressure. And race is a big one. Black people, we are twice as likely compared to white people to have high blood pressure, although this starts to come in, the gap narrows after age 44, and after age 65, black women have the highest incidence of high blood pressure. So remember that, as we black people are more prone to high blood pressure than white people. Thyroid disease is another component of high blood pressure. One thing I wanted to mention is there are different kinds of hypertension. Essential hypertension, which can be caused, like, for example, family history or, genetics, things like that. You can't do anything about that. It's essential hypertension. There's, however, secondary hypertension that is caused by something else, like medications, like patients that have adrenal tumors or thyroid disease, or certain things like if you are young, say you are 30 or 40 and you have high blood pressure and it's uncontrolled. Even patients that are older and have significantly high blood pressure that cannot be controlled with medications very well, we try to rule out secondary causes of hypertension, like trying to check and see if they have renal artery stenosis. If you have your blood vessels that thin in the kidneys, we normally can order ultrasounds to check for that. We can do some blood tests to check if you have some concern with renin aldosteronism that maybe you're producing more renin, more aldosterone, things like that. So my point bringing this to you is, if you have high blood pressure and you're wondering if you're, especially if you're young or if it's not under control, you're wondering why, you can ask your doctor to check for other causes of high blood pressure. They can actually be concerned even and bring that up to you, and those things can help. If you can check thyroid, check other things, and see if you're taking medications that are not, that you think can cause it. You got to stop and see if that helps. Symptoms of high blood pressure: early morning headaches, like I told you in my other podcast, the last one, when I just did some quick temperature check. I was saying I was having headaches every morning, and so I went and checked my blood pressure, and it was high. It was like 130, 1/70 something, which is not normal for me. So I checked it other days and it was normal, but that made me worry, and that's why I checked my blood pressure. Nosebleeds, irregular heart rhythms, vision changes, buzzing, ringing in the ears, fatigue, dizziness, all these things you can look and see can cause the symptoms of hypertension. But again, most people that do have high blood pressure do not have any symptoms. Remember that. Severe hypertension symptoms: when patient's blood pressure is super high, in the 180s, 190s, over 110, 120, they can have nausea, vomiting, confusion, because their brain has a lot of pressure, high pressures in the vessels of the brain. Anxiety, chest pain, like I said before, shortness of breath from heart failure, muscle tremors. People can actually have aneurysms, dissection, where they can just die. So that's why when you see that your blood pressure is super high like that, you need to right away get help. Now, surprising facts: most times people have no symptoms, like I said before. So many people who have high blood pressure do not know it. So I am pleading and asking and begging that you should check your blood pressure. It doesn't matter whether you're young, middle aged, they are more frequently than not having higher blood pressure now compared to in the past. And hypertension may be linked to dementia. So please remember that it's important to check and know that this is preventable. And so 1.3 billion worldwide have hypertension, and it's killing 10 million people every year. So it's very important to please check your blood pressure, because if you do notice it's high, you need to do something about it. Fun facts about hypertension: approximately 65% of people over age 65 have high blood pressure. So if you do not have high blood pressure by age 55, you have a 90% chance of developing it later. Isn't that so scary? It is scary to me. So please, please, please remember to, I challenge you today to check your blood pressure. Monitoring your blood pressure is something I want you to do, and I'm going to tell you in the next episode how to monitor your blood pressure very well, or do it in a good and better fashion. Management of hypertension, we're going to talk about it in depth in our next episode, and lifestyle changes. So please, before the next episode, I want you to check your blood pressure every single day, so that when we talk next, you can know, do I have it? Do I not have high blood pressure? So that we can help figure this out. Challenging you, do check your blood pressure, okay? I really care, and I hope that you do know that we are doing our best to make these episodes better. Much love. Stay tuned.